My name is Ayana Cully. I am been recently named the Senior Vice President and COO at National Health Resources. Prior to that, I was the Vice President and at the same company. And prior to that, I was Senior Project Manager. And prior to that, I was an auditor. I have a background in HIM first. I always like to say HIM first. So I was an RHIT coder, and then I went and I got a nursing degree, and I did nursing for some time, and I actually did both at the same time for some time. And then after a while, I transitioned into consulting, auditing, back into revenue cycle management. And that's where I've been for the last 10 years or so. I still use my clinical knowledge every day, but our focus is more revenue cycle management. A typical day for me, it varies day to day, I will say. I am what I like to call a practitioner executive. So I actually have coding background, auditing background, and act as a subject matter expert for our staff. But for me, in the role that I'm in, usually in the morning, before 8 o'clock, between 7:30 and 8 o'clock, I'm checking my emails to check our staffing levels, make sure we have enough coverage. We didn't have a lot of sick calls or otherwise other types of calls. So just want to ensure that all of our consulting contracts are covered. I might have any pressing emails, maybe someone emailed me something, or I need to ask some of my administrative managers for something, or they could work on something. So I might send out some emails that I need them to address earlier in the day rather than later. Then I'll make it into work. And I'll look at my calendar. I typically look at the calendar the night before, but I'll review the calendar again to make sure I'm on top of any meetings that I need to make. And I'll also check it for the rest of the week because there might be reports that I need to prepare. I need to follow up with different staff and you just follow up with meetings that we have upcoming. Then for like today, I'll just go with how it's just all over the place, but I had to contact our payroll company, make sure our payroll went through because payroll's at the end of the month. So I coordinated with my administrative manager that handles that just to confirm that everything went through because I didn't see my typical email that I normally get. So something like that might happen. I'm working on, we're creating a new handbook with some of my team members. So we'll have to review, we have some drafts going back and forth. So I'll be reviewing that to make any suggestions and changes so that we can hopefully finalize in the next couple of weeks. Then we have a new marketing team. So they met with us a few times. I have to wait for them to send me something and then we're going to follow up. So I'm waiting for their draft of what we're going to be doing and I'll communicate with them a little bit. I have an IT team and we're constantly updating our system, our proprietary system. And we have suggestions either from our clients or even from our staff. I'm always looking to make things easier for them, not harder, and clearer for our clients and value added. So I take suggestions from all of them. I speak to the IT team, let them work on it. Then we have some quality testing that needs to happen. And there's always this constant refinement. Do you mean it this way? Do you mean it that way? And, so I have that. I saw an email early this morning that they sent me a draft of what they came up with based on previous conversation. I have a new employee that we're going to be onboarding in the next couple of weeks. So I have to ensure that all of her accesses were granted with our clients. So my administrative manager just asked me, did we get that? Because we want to ensure when she starts, she has everything that she needs. So yeah, that's a typical. Now, in between all of that, I may get calls from my staff. We do have an escalation system. So once it gets to me, it's usually something that either my AVP or VP couldn't, not necessarily couldn't handle, but it just might be something that we all need to discuss and sort of put our heads together, because everybody knows coding is not sort of black and white. So I'll get calls like that in between, and we'll sort of put our heads together about a specific case. I may get calls from clients that also are having some difficulty. They might be there. A typical question might be, is there a guideline for XYZ? Or, I would like to do this. Is there any conflicting, is there a reason why I couldn't? So a lot of times we might have to do some research, or a lot of times we know off the top of our head, but we might have to dig up the actual federal register that it was documented in, to give them the background information on a particular issue. So that's a typical day. I know it sounds like a lot, but it just sort of flows together. Tomorrow, I might have to do quality assurance audits. And, while my supervisors, AVPs, and VPs can handle the audits, they do like to come to me to give me the outcome and say, this is what happened. Or they may have been more conservative on an action, and they may say, look, I think I might be a little conservative. What do you think? Do you think it's okay? And I'll give my opinion, but I'm able to do that because I do have a coding and auditing background. So they're able to come to me with those types of questions. So, tomorrow might be auditing our own staff. I might be putting a report together of, the last 6-month outcomes for a specific client, or they might be asking a specific question about, quality metrics with their own staff, and what could I provide them around that. So it depends. I know very well the position that new graduates are in. But my suggestion and what worked for me is trying to get into volunteer. So 2 pieces of advice. One is, if you already work in a hospital system, and this is what I did, and it worked well for me. If you're already in the hospital system, and I know it's a little bit difficult now that we have EMRs and things like that, but you can still try contacting the HIM department and asking them if you could volunteer. If you could just come and look at charts, because you've already got approval and access, you work for that system, it should be a little bit less difficult to give the access to the record. But if you're asking for permission, you're asking, they might set aside some cases that you could look at, and you are looking at it to try to code, or this is for coding, I'll say. You're trying to code it on your own, and then you code it and compare what was actually coded. And that in that way you can kind of learn, oh, well, why did I do it this way and they did it that way? And you're kind of trying to understand how to do it. You could also ask questions if they're available. Why did their coder do this and do that? If you're doing operations, you could also ask to shadow the manager. They sometimes like that. I actually had a manager that was just as happy to have me follow them around, carry their things. This is, fine. So those are 2 ways. I mean, I know people are short on time, so they might not have the time to do that, but it doesn't hurt to ask. And, maybe it's just 1 day a week. I used to go down on my lunch break and look at charts. And that I found that really helpful for me, just to sort of understand what's picked up, what wasn't picked up. And then you get to know management there. if you don't work in a hospital system, um, trying to volunteer, just contact cold calling them to see if they offer any volunteer opportunities. You could say that you're looking to get into HIM field, whether it's coding or operations, and there's going to be someone that's open to it. A lot of the directors are educators themselves, so they appreciate that type of ingenuity. And you do it for free. This is what it is, but it's a way for you to get experience. And if you need to get a recommendation letter at a later time, you can do that. You'll be able to be in the system and see if there are any open positions that are coming up, and they might recommend you to apply. And that's my recommendation, is to volunteer. It may not take as long as you think, but treat it like a job. If you say you're going to show up, you'd like to come in, 9 to 12 every day, or whatever the time is that you set, make sure you come in and treat it like a job. And you be there on time and dress professionally, and, ask questions. Maybe you set up a time so you're not constantly interrupting them. And if you're going to be there 9 to 12 and you say, can I come at 11:30, and maybe ask any questions I might have. And so you're not sort of continuously bothering them, and they feel like you're more of a help, or not necessarily a distraction while you're there. Going to your local AHIMA meetings, your local chapter meetings, the state one, and also the national AHIMA, going to the student, they used to have a student day or something. That's a place where you'll meet other HIM individuals, where you can develop that relationship to then maybe come on in some capacity, volunteer, or for a job. I went to AHIMA when I was a student, and I was offered 3 jobs as a student while I was there. So, going to those association meetings can be really helpful, and add to the credibility of, oh, okay, this is someone that is taking their profession seriously, and they might be more willing to allow you to come in to do either volunteer work, or they might have another position that they might think you might be a good fit for.